When someone is seriously ill or dying, we can help them or those close to them take the opportunity, if they wish, to create lasting memories. At NUH, we use the SWAN Model of Care. This model of care focuses on individual needs of the patient and those close to them. At the core of this model is compassionate communication and compassionate actions. The SWAN sign or symbol should be explained to the patient and those close to them before being placed visibly for all to see. The symbol is available as a visual sign that is recognised by all members of the team. It indicates that the situation the patient and those close to them find themselves in is one of uncertainty, facing deterioration and dying. It enables staff to focus their care on what matters to the patient and those close to them. With the support of NUH Charity and donations from the public, we have access to resources that can be offered at this time. It will enable the patient and those close to them to make positive, lasting memories. The aim of this video is to demonstrate how to use some of those resources, but also for staff to feel confident in sensitively exploring the offer of options to create these memories, individual to that patient and their loved ones. It is never a process to be followed, but to work with the patient, energy dependent and those close to them, with what is important to them at this time. We will demonstrate some of these options and we'll mention others that can be considered. For example, using handprints, lip prints and footprints, the offer of a hair lock, hearts, blankets, teddies and a memory box. Other things that can be considered are voice recording, video messages, photographs with the patient's consent but only on personal devices, and this list is not exhaustive. The SWAN model and symbol can be explained to patients and those close to them in the following way. However, this is not a script. I'm sorry you find yourself in a situation where your loved one is deteriorating. We very much want to ensure that the time they have left focuses on their comfort and what is important to them and you. At NUH, we use the SWAN Model of Care. It stands for signs, words, actions and needs. As part of the care, we have a symbol that can be placed discreetly outside the room or nearby. This enables us to ensure that comfort is a priority. For example, it alerts the team who take the blood to consider, is this necessary? Or for the food services assistants to ask, would you like a drink? There are many things that we can do, so please let us know if there is anything important to you at this time. We have access to a camp bed or a comfortable chair, and if faith is important, we can contact our chaplaincy service for support.
Handprints are one of the most used resources when a patient is seriously ill or dying. Conversations about handprints should be done in a sensitive manner with the patient, if they are alert and able, and their families or loved ones. When offering handprints, it is important to emphasise that this is an offer and not a process. Whilst the offer of handprints is largely accepted, they are sometimes declined. Each family member and their circumstances are different, and care of the dying should always be personalised. Handprints can be taken before and after death, but should always be done before the patient leaves the ward, and where possible given directly to the family or loved ones at the time. Those closest to the patient may want to help take the handprint. This helps embed their experience in their memory, which can also bring additional comfort. Families can use the prints in many different ways, including framing and decorating. If you feel confident and it is appropriate to do so, you may wish to explore different ways to use prints with the patients and their families. Hair locks are one of the most used resources when a patient is seriously ill or dying. Be considerate about the patient's hair condition. Have they recently had chemotherapy? Do they have enough hair? And is the hair long enough? Those close to the patient may want to help take the hair lock. The pouches can also be used for precious items such as jewellery or wedding rings and then returned to the family. Whatever the relationship, as a staff member, your role in offering memory boxes plays an important role in the grieving process and mustn't be underestimated. A memory box can be discussed with the patient, and if their energy allows, they may want to get involved in creating a list of contents for the box. Often, the box is used by children and young people. Creating a memory box is an ideal way for a person close to the patient to keep their physical memory safe, in a place for some enabling reflection on a time shared together. For those who have not been able to share time together, such as an unborn child or a young child who is unable to recall memories, it can help build memories or fill in gaps of the person who has died. It is simply a collection of items and personal belongings that remind the person of their loved one. The box is not used to put items in, it is for the creation of personal memories. Knitted blankets and hearts were introduced at the beginning of the COVID-19 pandemic as a way of sending keepsakes to families who could not be together due to visiting restrictions. They come in a variety of patterns and colours, so it may be nice for the patient or family member to choose a blanket, perhaps in their favourite colour. Blankets are designed to place on the patient's bed as a way of personalising their care. Hearts and teddy bears have been designed to bring comfort to patients and their loved ones. They can be particularly comforting when somebody close to the patient is unable to visit and can provide reassurance that the patient was or is not alone during this difficult time. And here are a few ideas taken from clinical areas. Using 2 identical hearts, give one to the patient to keep and the other to the loved one to take home. Using a group of hearts, you can give a heart to a patient and then give out multiple different hearts to members of the family as a gift from the patient. Give one teddy bear to the patient to keep and the other one to the relative to keep. Keepsakes for children. Give a bear to a grandchild or a child to remember their loved one. It could be a present from Grandad or just something to simply remember them by. Hearts and teddies can either remain with the patient after death or return to the family. This is a personal decision.
Our final act of care for the family or those close to the patient is to ensure the information they receive regarding bereavement services is accurate and timely. This too needs to be done with compassion. Being able to say you are sorry for the death of the person close to them with empathy is essential. They need to be given the Bereavement Centre contact details, either through being given the bereavement booklet or being signposted to the NUH internet page bereavement section, where the booklet can be viewed or printed. You have access to bereavement cards. The card has pre-printed words. Again, this is not a part of a process, but to be sent by someone who cared for the patient, and they can personalise the message. Arrangements need to be made to collect belongings from the ward if they're not taken at the time of death. Please ensure the patient's property is returned neatly packed in a SWAN bag. We hope this video helps you to consider how you can introduce the SWAN model of care. It is important to acknowledge using the resources with sensitivity to meet the individual needs of patients and those close to them can also provide staff with comfort too. Your actions and words stay with those who are bereaved. Never underestimate the comforting impact you can have that will last a lifetime.